So I want to talk to you a little bit about Marfans, and the reason you need to know about it, even though it doesn't really have a lot of neuro-op, it has a lot of op. And it's like Ehlers-Danlos, and if you're interested in that Ehlers-Danlos, you can watch that video. And basically, it's a connective tissue problem, and it's familial, and the autosomal dominant form is the fibrillin gene, and that means connective tissue problems. And so for the eye, that means you can get a corneal problem, so you can get astigmatism or things that look like keratoconus from thinning of the cornea, and so they might have contact lens problems and refractive errors. The lens problem is because you get zonule that's not right, and so you can get superior temporal dislocation, so the lens will be dislocated superior temporally, and that's one of the causes of ectopia lentis, which is spontaneous and non-traumatic. And in the back of the eye, you're going to get axial myopia because the sclera is weak. And so when you have a weak eye wall, your eye will get bigger, and that's the axial myopia. And in the periphery, they might have the myopia findings of lattice degeneration. They're going to be at lifelong risk for retinal detachment. And because the sclera is thin, it might be blue. So it's very similar to the findings that we see in the ocular form of Ehlers-Danlos syndrome. The same findings that we see in the connective tissue disorder, Ehlers-Danlos syndrome, there's overlap with these Marfan people. And because the Ehlers-Danlos people have a Marfanoid appearance with the arachnodactyly and the hypermobility, these are often confused. And so you need to know a little bit about Marfan syndrome, and basically it's a connective tissue problem. Things are thin cornea, thin zonules, thin sclera, thin retina, lattice degeneration. Not much neuro-op there, but because Ehlers-Danlos does have some neuro-op, especially the type 4 vascular type, you need to be able to differentiate Marfan from Ehlers-Danlos. And the key and differentiating thing that you might see on the exams is the ectopia lentis, a non-traumatic spontaneous dislocation of the lens. The Marfan people tall, so it tends to go superior temporal, like up, rather than the homocystinuria patients where the lens dislocates down.